Okay, so we're continuing the appendicular skeletons, part 2. So this is the upper limb. So the upper limb has 30 bones, surprisingly enough. Most of those, though, are in the wrist and hand. So there's only 3 other bones that are in the arm. The upper arm has 1 bone. The forearm has 2 bones. So the upper arm, the brachial region, if you remember that from the first lab, it has the bone is called the humerus. Lower arm, the antebrachial region, has the ulna and radius. The wrist and hand have 27 bones. There's 8 carpals and 19 bones in the hand. And those are metacarpals and phalanges. Next slide. So here's the humerus, the upper arm bone. And you see the head of the humerus there. And it's covered with hyaline cartilage. That's why it's blue here. And then you have just beneath that, you have what's called the anatomical neck. Then you have the greater and lesser tubercles, those small rounded projections coming off there. There's also this intertubercular sulcus, which is a little groove that goes between the greater and lesser tubercles of the humerus. The anatomical neck is this kind of depression just distal to the head of the humerus. Then there's the surgical neck, which is where the breakages occur. The deltoid tuberosity, you can see it sticking off there and here. So this is an anterior view on the left and a posterior view on the right. Then as you head on down the rest of the humerus, you reach the distal end of the humerus, and we have where the humerus is going to articulate with the radius and ulna. There are 2 sections there in blue. The medial section is called the trochlea, and the lateral section is called the capitulum. And so the trochlea is it articulates, with the ulna, and the capitulum articulates with the radius. So, and because the radius has to kind of spin around a little bit, so it needs a more rounded surface. The ulna has as you'll see, has a notch in it, and so it's more of a lever, it functions as a lever. Then you have some fossa. Well, you also have, since these, the capitulum and trochlea are basically condyles, so what you have are epicondyles, and you have the lateral epicondyle and a medial epicondyle. Medial epicondyle is actually important as a you can actually feel it if you push yourself in an anatomical position, and you can actually feel a little bony projection sticking off there, and then there's a little dent right next to it. And if you press hard enough on that little dent, you'll actually compress what's called the ulnar nerve, and you make your little finger kind of like buzz a little bit and kind of feel like it's going to sleep. So that little groove right next to the medial epicondyle, just lateral to the medial epicondyle in the anatomical position, is a groove where the ulnar nerve goes through. You can feel both condyles, the lateral condyle, epicondyle, and the medial epicondyle. Medial epicondyle is also important in that range around the elbows, where there's some ligaments that go around that, and those ligaments are some ones that are torn and have to be fixed with Tommy John surgery. If you follow baseball at all, you'll know what that refers to. Then there's some fossa that are on the anterior and posterior side. On the anterior side, there's a coronoid fossa, and on the posterior side, there's the olecranon fossa. So the olecranon fossa, or olecranal fossa, so it's olecranal fossa, F-O-S-S-A, the ulna has a extension on it that fits into that fossa. So when you extend your arm, you actually feel this. If you extend your arm, you'll feel your elbow, and you can feel it go back into, and it actually goes back into that olecranal fossa back there. Okay, next slide. So here's a picture of the actual picture of the humerus, and you can see the head. You can see the number 7 is actually the anatomical neck. So that's anatomical neck there. So then you have the greater and lesser tubercle, tubercular sulcus, not the intertubular, but tubercular. I'll rewrite that slide later. Let's see, deltoid tuberosity down here in the middle, and then you have the anterior view. So you have the coronoid fossa in the front and the anterior side. There's a radial fossa there because if the elbow gets bent, the head of the radius comes up and needs a little slot to fit there. Lateral epicondyle, because this is the lateral side, and the capitulum is here, and the trochlea is here. Trochlea means pulley, so there's I'll show you the trochlear notch that's going to fit over the trochlea. The trochlear notch is on the ulna. We'll come to that a little bit later. So here's the olecranon on the posterior side, olecranon fossa or olecranal fossa, and the lateral epicondyle is easily seen on this side as well. Next slide. So here's the radius and the ulna. And so we were talking about the olecranon, which is this back side. This is the posterior side. Over here is posterior. This is anterior. And so we have, this is a notch. And so if you look over here on the bottom, on the right side down here, we have the olecranon. This is called the olecranon here, this part. And this is the trochlear notch. And it's a groove. It's kind of a semicircle that fits into the fits around the capitulum. Oh, sorry, the trochlea, not the trochlea. Sorry. Sorry, it's getting late. The head of the radius it articulates with the capitulum. So it's hard to see it in these little tiny pictures. But I'll try to do a little video showing you how these guys all fit together here in a little bit. So we have this is the posterior side of the ulna, and then here's the radius, and the radius and the ulna come together where they touch is actually there's a radial notch. There's a little notch in the ulna where the radius fits in there. So this is the head of the radius. Then we have the neck of the radius there. Then with the radial tuberosity, there's a little bump that sticks out there. Then on the I should probably continue on the radius all the way down. So you have the radial tuberosity, the radius. There's a distal joint, a radial ulnar joint where the radius and ulna come together again, and the radial styloid process is a little bump that sticks off the bottom down there. Then if you go back to the ulna, here is the ulna. So the trochlear notch, the olecranon and backs, that's your elbow. And then you have this is called the coronoid process. Then you have the radial ulnar joint showing it. That's the proximal end of it. And then there's the distal radial ulnar joint down here. So with the proximal end and the distal end down here. So then between these two bones, there's otherwise they kind of flop around. So there's a fibrous tissue, and this is all called an interosseous membrane. It's fibrous connective tissue that's holding these two bones together. Then we have there's a little tiny notch that the ulna fits into. Then here's the head of the ulnar head down here, and the styloid process, the ulna. So you actually have two styloid processes, one for the radius and one for the ulna. And you can actually tell which bone is which by the styloid processes. Also, it's easy to tell because you got this big old olecranon sitting here and trochlear notch, so it's easy to tell what the radius is. The hard part is to tell whether it's left or right, and that's part of the practical that we normally do. I'm not exactly sure how we're going to do that practical, but since we usually do that in person, I'll lay those bones out on the table and ask you to tell me which one's left or right. So we're going to have to do things a little bit differently since we're doing all this online now. So anyway, The interesting part about the radius is there's this part down here is very flat, and it's a ski slope kind of look to it. So it's flat and it curves anteriorly forward, and so it makes it very distinctive as to which side is anterior on the radius. So some things you look for the radial styloid process. You always put that on the lateral side. Ski slope goes in front; it's anterior, and then the radial head is going to be the most proximal end. And then there's going to be a notch on the ulna where the radius fits into, so you know which side of the ulna the radius is going to fit into. So you can, and then you can take the ulna, you can look at it and look at the trochlear notch, and you figure out from it and which side the radial notch is on. That'll tell you which side that ulna is supposed to go on. You can also look at the styloid process of the ulna down here, and you can see that there's you always put that on the medial side. So, any case, all right, next slide. So here's a magnified view of the olecranon and trochlear notch in the coronoid process, and you can see how they fit together here in the elbow joint. So you have this olecranon, the trochlear notch fitting around the trochlea of the humerus. So here's the elbow joint. This is showing actual bones. This is from your guys' textbook. So, or from the textbook, and we have an anterior view. So we'll start with the posterior view on the right B over here. And so you have the olecranon, the olecranal fossa here where the olecranon fits into, and the lateral and medial epicondyles of the humerus. Then you have the radial head fitting in here and the radial neck. And so here's your radius is here, and this is the ulna here. Then on come over to the anterior view, we're looking at this, and so we have the coronoid process of the ulna. It fits into the coronoid fossa. We have the trochlea, so the trochlear notch of the ulna fits around the trochlea there. They have the head of the radius over here. It articulates with the capitulum, and then you have the radial fossa here. So when this radial head swings all the way up, there's a little divot for it to fit into, and so it doesn't bump into the bone. Then you have the radial neck. They have the rest radius and the radial tuberosity sticking off here. And then you have the radial notch in the ulna here, where the head of the radius is able to fit into a little notch here that you can't see because they're touching in this picture. So, but that's where it is. Next slide. So here's the olecranon, a little bit better picture. Olecranon here, trochlear notch, coronoid process, and the radial notch. Now you can see it really well there. And then you don't have to know about the ulnar tuberosity. Here's the capitulum where the radius attaches to, the coronoid fossa here, trochlea, and coronoid process. So here's the humerus up here. Here's the ulna, and then the radius on the lateral side. So you have the styloid process of the radius, and that's always on the lateral side, and the interosseous membrane, and then you have the ulna. Then if you head on down to the, so let me go back up to the humerus. You have the olecranal fossa, the olecranon from the of the ulna fitting into the olecranal fossa, the head of the radius, and then styloid process of the radius is down here. So you see that's on the lateral side. So then as you go on down, you start seeing the wrist bones, which are called the carpals, and you're also going to have, so that's the carpals. These are the metacarpals, and these are all the phalanges. So that tells you, that shows you what all of the bones are in the wrists and hands. And the way to remember which one's lateral and which one's medial, the ulna, if you reach up and touch your elbow, and then follow that bone all the way down. You'll realize it goes all the way down to the pinky finger. So one way I remember it is to go PU, like stinky in here. It's PU. So pinky ulna. The other way you can think of it is put yourself in anatomical position and go radius ulna medial. And so you go, are you kidding me? So radius ulna, kidding me for medial. So that's another way of remembering it. So there's two little easy ways of remembering which one's which. So radius and ulna. Radius is on the thumb side, ulna is on the pinky side. Next slide. So here's actual bones showing the head of the radius and the, where it fits into the radial notch of the ulna. You have the olecranon. It's difficult to see in this picture, the trochlear notch, but it's there. It looks almost like a bulge in this photograph. And the coronoid process sticking off the anterior side of the ulna there. And you have this smooth ski slope anterior surface of the ulna down here. So this whole part is very smooth. Looks like a ski slope because it just sort of flares out. If you look at it from the side, it looks like it goes like this. So you have that ski slope like that. So the styloid process of the radius, that's always on the lateral side, so that helps you know that the ski slope in front. Styloid process on the right, that lets you know it's a right radius. So, and right ulna. And the styloid process ulna, you can use that as well. Just put that medially and look for put the trochlear notch, pointing forward, pointing anteriorly, and you're in business. So, next slide. So, here's the bones of the wrist and the hand. So, the way to remember the bones of the wrist is pretty easy. A little saying: Sam likes to push the toy car hard. So, the names of the bones are scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. And if you'll notice, trapezium and trapezoid, those are in alphabetical order. So that helps also, because you have two T's right in a row. So the scaphoid, lunate, triquetrum. So Sam likes to, scaphoid, lunate, triquetrum, push the toy car hard. Pisiform, trapezium, trapezoid, capitate, hamate. So the proximal carpals are the scaphoid bone, lunate, triquetrum, and pisiform. So basically what you have are, you have 3, 4, 5, 6, 7, 8 bones. Okay, so when you're looking at these, look at these bones. You think of them as in two rows, and that's why the proximal carpals, there's 4 bones, and the distal carpals, there's 4 bones. So we have the proximal carpals are, you have the scaphoid here, lunate here, triquetrum here, and pisiform is sitting on top of it. Okay, so that's the first 4. So you're in anatomical position. This is our right hand, so you're looking at the palm, so it's anatomical position. So the most proximal ones are the scaphoid, lunate, triquetrum, and pisiform. Then the next 4 in order would be the trapezium, the trapezoid, the capitate, and the hamate. So those 4 in order. So Sam likes to push the toy car hard. And so that's a fairly easy way to remember those. Then if you look at the phalanges, or sorry, let's look at the metacarpals first. So we have the metacarpals are here, there. And so, and the bones are all numbered starting from the thumb. So they're numbered with Roman numerals 1, 1, 2, 3, 4, and 5. So you have metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, metacarpal 5, and obviously since this is right hand, you'd have to say right metacarpal 1, right metacarpal 2, right metacarpal 3, right metacarpal 4, right metacarpal 5. There's also, you'll notice there's also these 2 sesamoid bones. There's 2 little tiny bones that form right at the base, or at the distal end of the first metacarpal there. So there are a couple more sesamoid bones other than just the patella. Then the rest of these bones are phalanges, and they're also numbered 1, 2, 3, 4, and 5. So this is 1, 2, 3, 4, and 5, and these are the proximal phalanges. So this is proximal phalanx. So it's a single one is phalanx. That's singular. So this is proximal phalanx 1, proximal phalanx 2, proximal phalanx 3, proximal phalanx 4, proximal phalanx 5. Then you only have 2 bones in the thumb here. So if you notice, you take your thumb, you can bend it and make an L. But if you do all the rest of your fingers, you can actually curl them all the way over and make a U shape out of all of those. The digits 2, 3, 4, 2, 3, 4, and 2, 3, 4, and 5. So what you have in the middle ones, you have 2, 3, 4, and 5. So you have middle phalanx 2, middle phalanx 3, middle phalanx 4, middle phalanx 5. And then you have distal phalanx 1, and distal phalanx 2, and distal phalanx 3, and distal phalanx 4, and distal phalanx 5. So you have proximal, middle, and distal phalanges. And the thumb doesn't have a middle phalanx. It only has a proximal and distal. So there are the bones of the wrist and hand. So you've learned all those real fast. Pretty easy, huh? So here's another view. This is if you have the hand pointing down towards you, you have the proximal row of carpals and the distal row of carpals, and then the metacarpals and the phalanges. So just showing you another view of those. And you have the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. So scaphoid, Sam, lunate, likes, triquetrum, 2, pisiform, push, trapezium, the, trapezoid, toy. So trapezium and toy have an O in them. Car, capitate, and hamate. So I can help you remember those. Next slide. So, and we've gone through all the carpals and the metacarpals and the proximal, middle, and distal phalanges. So I'm not going to go through this again. And that's just a posterior view of the carpals and phalanges. And so you tell it's difficult to see the pisiform bone from the posterior view. So Sam likes to push the toy car hard. And next slide. Not much to say here. Let's see, except for the thumb is also called the pollex. So you can see that down there. So I've already gone through all that stuff. Next slide. So I thought it'd be interesting to see a fracture, see what it looks like. So here's a fracture of the radius. There's a little tiny fracture that you can see there. This right radial fracture. There's a little piece sticking off that you can see in this on this right one over on this side there. So you see where the arrow pointing to. And you also see all the bones. And so I've labeled all the bones for you, so you know, or the wrist bones for you. So scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. So that's what it looks like in an X-ray. Next slide.